I think that there are a lot of pressures and a lot of people calling for reduced restrictions, but if you think about what's happened over the course of the pandemic, really we've toggled a lot of major decisions off of healthcare capacity and the ability of our healthcare system to look after people with COVID and non-COVID conditions. And right now things remain extremely stressed to the point of threadbare in the healthcare system. Even though many people are coming in and they do not necessarily have COVID as their primary diagnosis, that's still the majority have COVID as their main diagnosis. If they have COVID or not, they're still taking up hospital beds. They still require all of the resources. And we're still seeing some people getting very, very ill and requiring specialized care. For the last 2 weeks, we've seen the daily census of COVID patients in hospital is over 1,500 patients, which is kind of the equivalent of 5 community hospitals worth of COVID patients that require care. And we're still seeing people requiring ICU admissions, still seeing people dying of severe COVID, even though Omicron is said to be mild. It clearly is not mild in the unvaccinated or in people who are, immunocompromised. There are a lot of pressures on decision makers, and there's no doubt about that. I also think that certain types of public, advocacy do take up a lot more space than all of the quiet people who've been doing the right thing since the beginning. And there is some political aspects to it. I'd also say that, it's very difficult when things are shifting so quickly to know for sure what the right answer is. So you end up doing a lot of looking what's happening elsewhere, such as the UK, where they've had sustained high healthcare utilization. And also, basically looking at the actual risks of any proposed course of action. And so it's a difficult situation, but I would have to say that there appear to be considerable risks to me to lightening this up too quickly. There's been a tremendous amount of pretty constant transmission, and what I feel like what we've been seeing in hospital is Omicron finding the vulnerable, be they unvaccinated vulnerable people, of which there's still quite a few in the community, or people who've been vaccinated but are at risk of not having a full vaccine response because of their medical conditions. And so we've been seeing people come in sick basically the same way over the last few weeks. It hasn't been changing at all. And I just feel like it's finding everyone that it's going to find, and that could continue for a considerable time. When you think about the transmission piece, it feels like people say, well, they can still transmit, so there's no point. But that kind of is starting in the middle. You really have to start from saying, are you going to get infected in the first place? We know that 3 doses of vaccine will reduce the risk of an individual becoming infected, which automatically means that they will not forward spread the infection. But yeah, I think that argument is kind of gotten a little bit warped in my mind in the public discussion, because to me, if you're preventing infection, you're preventing transmission as well.